Hi and welcome. I'm trying to learn history. Today, Addison's disease. And after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's better to help us. And we're talking about internal anatomy. This is part 3 or 4. And we're talking about the disease and something else. This is no medical advice. So we're just reading and learning about it. Now we want to do a presentation about it, so we're rehearsing a bit. Addison's disease. Where do the adrenal glands above the kidneys keys to work or stop the work and produce stop the work, and we are normally controlling the metabolism of salts and also the sexual organs. The symptoms starting gradually but becoming then more and more severe, and if they are neglected, if they are ignored, if they are not recognized, then oftentimes the first symptom is sudden collapse. Now it is fatigue and weakness. Fatigue and weakness, which is good, I think. Fatigue. Where was fatigue? There was never fatigue written. Weakness and tiredness. Weakness and tiredness. Loss of appetite, nausea, and abdominal pain. But I have to remember it, not just say it. I have to say it in a moment without the book. Weakness and tiredness, nausea, and loss of appetite and abdominal pain. Fainting. Is that right? Fainting caused through low blood pressure. And then darkening of the skin, accentuated by sunlight, and dark patches inside the mouth. Okay. Tiredness and weakness, nausea, loss of appetite, and I want to say fatigue. Loss of appetite, nausea, abdominal pain was. Tiredness and weakness, loss of appetite, nausea, and abdominal pain, and also fainting on upstanding. And it is caused low blood pressure. And also darkening of skin, which is accentuated by sunlight, and dark patches in the mouth. Inside the mouth. Darkening of the skin, darkening of skin. And also then fainting after upstanding and collapse. What is the difference between fainting and collapse? And what is when syncope? So, collapse after minor physical stresses, okay. The condition is permanent, even with drug treatment. And drug treatment has to be done in collaboration with patient and doctor. Is important to manage this. So that we can learn, or we have to learn, to regulate the dosage of the drugs. And it is caused through destruction of the outer layer of the adrenal glands. By autoimmune processes. So the own body is attacking for some reason. Or reacting against attacking the outer layer of the adrenal glands. Failure of the circulation from low blood pressure, complications. Severe infections such as pneumonia. But that is because the person is weaker, I think, pneumonia. It doesn't really make sense if the person develops pneumonia just through Addison's disease. It is that they are weakened through Addison's disease and then get it. If undiagnosed and untreated, the condition can cause eventual circulatory collapse and death. I think we're going to say nothing to that. Doesn't really make sense to say that. Because it's not medical advice and we're focusing on the disease itself. But if you would say it, we would say the problems are low blood pressure and failure of the circulation through low blood pressure, failure of the circulation through low blood pressure, and severe infections such as pneumonia. Yes, it comes with an infection. Pneumonia, and it can cause circulatory problems up to collapse and death. Now, Special steroid tablets will be prescribed to replace the glands or hormones, and the drug treatment which is taken are steroid tablets. Steroid tablets. Okay. Now what we just started, and then we're going to look at what is missing. I'm starting the second camera. Addison's disease. By Addison's disease, the autoimmune system attacks the outer layer of the adrenal glands. The adrenal glands are both the two kidneys. And normally they're controlling the metabolism of salts and the sexual organs. And now they don't work properly anymore. Now, and the symptoms are weakness and tiredness and nausea, and also fainting when upstanding, and by small exercises also collapse. And also darkening of the skin, which is accentuated by sunlight, and dark patches at the inside of the mouth. And now, if it is ignored, if the symptoms are ignored or not recognized, then the first symptoms are then collapse. The whole Addison's disease can lead to through problems with the circulation, failure of the circulation, through low blood pressure, to collapse and death, and also to infections like pneumonia. Now, and if it is diagnosed, there is drug treatment, and that has to be done indefinitely. The symptoms all start gradually to get worse. Now, the drug treatment has to be done indefinitely, and the close cooperation between the doctor and the patient is important, and the patient has to learn to take the right dosage. And that is according now. I don't want to handle it. What are we missing? The steroid tablets. That's what I'm going to say. Addison's disease is readily controlled with tablets that replace the hormones produced by the adrenal glands, and with treatment the outlook is good. Steroid tablets. I think that was the only thing missing. Okay. Addison's disease. By Addison's disease, the autoimmune process of the body itself attacks the outer layer of the adrenal glands. They are above the kidneys, the adrenal glands. Normally, they are controlling the metabolism of salts and also the sexual organs. And now we don't do it anymore. And the symptoms are setting gradually on and getting worse. And if they are not recognized, then the first symptom is sudden collapse. Now, it is tiredness and weakness and nausea, abdominal pain and loss of appetite, and also darkening of the skin, which is accentuated by sunlight, and dark patches at the inside of the mouth. And complications can be a failure of the circulatory system through low blood pressure, infections, pneumonia, and then also collapse and death. Now, if recognized, there is drug treatment through steroid tablets, and the treatment has to be done indefinitely. These drugs are then replacing the hormones which the adrenal glands actually should do. And a close cooperation between doctor and patient is necessary, because the patient has to know the right proportions or dosages of the tablets, of steroid tablets. But if they are taken, the outlook is good. And that is according to Keith Hodgkin's Family Medical Advisor, page 63. I think we said it now. I'm going to stop the second camera. That means that it was a medical part. If you were here for medicine, and to go directly to the next, you can go directly to the next part of medicine. We will do now the shoulder impingement training. If you stay and participate in the shoulder impingement training, then it's better the own risk. Good in sail stance, and we're doing shoulder circuits. We're going back, up, back, front. And backwards. Now long arms, strong fists, and go as far back as you can with the shoulders. High up. And around, up, front, down, and backwards. Up, back, down, front. Now go a bit into the knees, hinge forward with not straight back. Let the arms hang, and I don't know what it's called. Pinch the shoulders together, and pull the shoulders together, shoulder blades. Make fists, lift the arms up and still draw the shoulder blades with force together. Lift the arms down with the shoulders, and then around, pinch the skeleton together. Request. Lift the arms up and still pinch the scapula together. Get the arms down, shoulders. And again into the knees, hinge forward, this time with a round back. Let the arms hang, make fists, turn the arms to the inside. Lift the arms high up, bring them together, straighten up, bring the shoulders down, together. So the arms are up, and together, shoulders down, and together. And release. Again into the knees, hinge forward, lift the round back, let the arms hang, make fists, turn the arms to the inside, lift the arms high up, bring them together. Straighten up, bring the shoulders down, together. Arms high up, and together, shoulders down. Now just feel out. And again, now, if this or any other exercise causes pain, then don't do it. Arms to the side and then up. And now we'll lift. Good as you stand, long arms, strong fists. And bring the shoulders down and together and turn the arms to the side. Arms to the outside, shoulders down and together. Arms again to the inside, shoulders down and together. And arms to the outside, shoulders down and together. And release. And now for a shrug. Lift the arms up. Shrug with shoulders. And go down. Again, the arms up. Shrug with shoulders. And go down. And last time. Arms up. Shoulders up. And now we press the curve, arms together, bring them down to the outside. And now, that's something like that. You can use the sock or something else. Have a little long arm at the outside. Lay the foot on. Try to catch it again. And on the other side. Leg goes bent, now stretching. One arm in front. Shoulders back, down. Pull the arm in, have flat fingers to the right to relax the arm. Go with back with the shoulder, turn the palm up to the scalp. So shoulders back and down. Pull the arm in, have flat fingers to the right to relax the arm. Go with back with the shoulder, turn the palm up to the scalp. And the arm. Shoulders back. Down, pull the arm in, have flat fingers, so right to relax the arm. Go a bit back with the shoulder, turn the palm up to the scalp. This was a short and pendulum training. I thank you very much, and until next time.